the coronavirus COVID-19 vaccine is safe and effective, and is the best protection against the disease. And in the UK, 2 vaccines have been approved for use. The AstraZeneca Oxford vaccine and the Pfizer-BioNTech vaccine. Both have gone through the checks by the regulating authority, the MHRA, and they are safe, effective, and suitable for the population. This is the same agency which regulates the use of any drug we have in the UK before we give it to patients and the public. And any vaccine in the future which is going to be used in addition to those 2 will have to go through the same checks and before it's released. As the moment, with all the trial patients who've had the COVID vaccines, the Oxford or the Pfizer ones, and with the million or so people who've had the vaccine recently, we haven't heard of any major side effects or major allergic reaction, and we haven't had any long-term complications reported so far. So as far as we know, it's as safe as it can be, and we would like as many people to have it. The difference between the 2 vaccines is in the way they present the dead bit of the virus to the body so that it can develop an immune reaction against it. The Oxford does that by having an actual dead piece of the virus injected into the body to have that immune reaction, while the Pfizer-BioNTech does that by putting in the instruction manual to make that dead piece of the virus, what we call the messenger RNA, into the body so that the body can make that piece of virus and then the body can develop the immune reaction to it, which is a new way of developing immunization and has been tested in other viruses. While the messenger RNA vaccine such as the Pfizer-BioNTech one has never been used in the market anywhere in the world, but the messenger RNA vaccine have been tested in humans before on at least 4 occasions in diseases such as rabies, influenza, cytomegalovirus, and the Zika virus. So we have used them in viruses and found out how they work in general, but with different viruses. So the information from that has been used in developing this vaccine, although it's for a different virus. Certainly not. The 2 approved vaccines, the Pfizer or the Oxford, do not contain any animal products, or human products, or egg, and the list of material used in making up the vaccine is available for the public to view on websites, and you can look for yourself what goes into those vaccines. The vaccine works by presenting a piece of the virus which is dead or inactive through an injection, usually into the body, so that the body then can recognize this piece of virus and develop an immune reaction to it, so that when the real virus comes back to attack the body, that immune reaction will be ready to hold it in place and inactivate it and kill it and stop it from infecting our cells, and thus protecting us from the disease. The COVID-19 vaccine is given as an injection into the muscle in the top of your arm. And it's usually given as 2 doses, and the second dose is usually given a few weeks after the first. And at the time of the injection, the first injection, they will give you an idea when the second dose will be given. And the government recently advised that we can give it up to 12 weeks from the first, with good protection from the first dose and better protection after the second dose. And the information is gathered constantly about how long the protection lasts after each dose, and whether we will need any more doses after the second in the future to keep the immunity level high. The recent change in the advice in giving the second dose of vaccine at 3 months instead of 3 weeks is related to the very high level of transmission of the virus, in particular the new variant that is causing so many infections in the community, which meant that to reduce that transmission, we need to vaccinate as many people as we can in the first go. And that means that you will have a good level of protection with the first dose as an individual, and that protection should start soon and last you for 3 months, and that's when we will give the second dose of the vaccine, and hopefully will allow that protection to carry on. That will help us by giving that first dose to many people to reduce the level of transmission and overall protect us individually and as a community from the disease. And then we can have the second dose to boost that protection and keep it longer, and hopefully have less of the virus going around. Like any other drug we have, there are bound to be some side effects, but these are usually mild and they are temporary and they don't last long. So for the COVID vaccine, some of the minor side effects are a soreness in the arm where the jab has gone, feeling tired, having a headache, feeling achy. And these are things you can have a paracetamol and hopefully they'll go away. If they stay for longer, if they get worse, if there's a temperature, then you need to check that you're not having an actual coronavirus infection or any other infection, and you should dial 111 for advice. The vaccine in its first dose will give you a reasonable protection, and this will last you up to 3 months. And the second dose will give you even a higher protection. But regrettably, that means that there are some people who will not have full protection. And also the immunity doesn't start straight away after getting the vaccine, and it takes up to 3 weeks before you have that protection, which means that you can catch the COVID virus straight after the vaccination. And we are still getting information and gathering evidence to what happens after the second dose and what happens after 3 months, and whether the immunity persists or goes down and there is a need for a booster vaccine afterwards. We can't be certain if the vaccine will stop us from carrying the virus in our body and from spreading it around to others unintentionally, what we call the asymptomatic carriers. So it is very important to continue with the other very important measures like social distancing, wearing masks, avoiding crowds and closed spaces that we have been following so far and has made the biggest impact on reducing the spread of the disease when we follow them properly. The answer is simple, and it all depends on what batches of vaccine would, will be delivered to your local health center where you're going to get your jab. If they get the Pfizer one, that's what you'll have. If they get the Oxford, then that's what you will have. Both of them are effective, so whichever one is offered to you, please have it, and you'll be protected, inshallah. When you call for your vaccination, let the staff at the center know what kind of reaction you've had in the past to drugs, tablets, previous vaccination like the flu jab, and then they will decide whether you should have the COVID vaccine or not. If once you've had the vaccine, you experience some reaction at the time, and this could be a allergic reaction, things like feeling general itchiness, swelling in your face, swelling in your tongue, difficulty in breathing, then the staff will recognize that and treat it immediately, and hopefully you'll have that without any side effects. If these develop very later on, then you should call 999 so they can treat it immediately. So please go ahead with your vaccine appointment and let the staff at the center know whether your reaction is serious enough that stops you from having the vaccination on the day. There is no evidence so far that the COVID-19 vaccine is unsafe to pregnant women or breastfeeding ladies. And there is no evidence that they can pass the disease. The vaccine can cause the disease in the woman or her baby. But we know that the disease can affect pregnant women and can affect the baby, and we've heard in the news that this has happened. Therefore, there's always a balance of risk of leaving the patients who may be at high risk of catching the disease without vaccination, and therefore the healthcare worker should have a chat with you if you are breastfeeding or pregnant and weigh the risks and benefits, and if necessary, having the vaccine. And I know some colleagues have had it who are in those groups, and should always look at the advice available to you at the time from your healthcare professionals or from the government website on the area. So it's at the moment does not cause any harm to give the vaccine if indicated. There is no group at the moment who could not have the vaccine altogether without weighing the risks and benefits of having the vaccine or not having it. And so some of those groups who may have to be carefully looked at are those people who have anticoagulation therapy like blood thinning medications, who may have a bleeding disorder, where the injections in the muscle might cause them to bleed. Those who have immunocompromised, where they're given medications to reduce their immunity because of various diseases. In those patients, we don't know whether they'll have a good immune response build up in their body from the vaccine to make them safe against the virus. We don't have enough data on that. We know that people with severe allergic reactions will have a higher risk of a reaction from the vaccine, so some of them may not qualify for the vaccine. We haven't got evidence that people with asthma or cancer itself, and I know personally people who are coming in for lung cancer surgery who would have had the vaccine, and we will wait for them to finish their doses of vaccine and then bring them for their surgery. So every patient should be considered on his own merit whether he qualifies for a vaccine or not. At the moment, the government has not made any plans to give the vaccines to children under that age because the studies have not been very clear in that regard. And the risks of them having severe disease or dying are very, very low. Therefore, they will not be amongst the priority groups to have it in the first wave of vaccination. More information will come through over the next few months, and the decision will be made if they need to be vaccinated or not. It's not obligatory to have the COVID vaccine, but you will be putting yourself and those people who you love around you at a risk of catching the COVID-19 infection. And that could be very serious and in some cases lead to death. And therefore, we would strongly recommend that you take the vaccine when offered. The government has set up many centers in the hospitals and in health centers around the country to deliver the vaccine. And they have set up some priority groups to decide who gets it first, starting with the over 80s and frontline workers who are caring for them and in the hospitals, and those who are shielding from frontline staff who are at high risk. And then there will be the other groups of adults and at risks. And the idea is to get millions of adults vaccinated in the next few weeks. The decision on who gets the vaccine will be sent to the GPs, and they will call the patients registered with them who are within those groups. So please register with your GP so that you can be called up when your turn comes. Please do not call the NHS or just drop into a center expecting to be vaccinated unless you've been given an appointment through your GP. You will not have the vaccine. Thank you.